What is the history behind sickle cell disease? Have you ever wondered how sickle cell disease came to be recognized as a medical condition? Sickle cell disease, often called SCD, was first described in the early 20th century. The earliest known case in the United States was reported in 1904. It involved a dental student named Walter Clement Noel from Grenada. His unique sickle-shaped red blood cells were observed by Dr. Ernest E. Irons, a medical intern, under the guidance of Dr. James B. Herrick. In 1910, Dr. Herrick published the first formal case report. This marked the official recognition of sickle cell disease. The name sickle cell anemia comes from the distinctive shape of the red blood cells. In the 1910s, Victor Emmel made early observations that led to the development of the first simple diagnostic test for sickling. This was crucial in confirming that SCD is a genetic condition. By the 1940s, researchers identified sickle cell disease as the first molecular disease. They characterized the differences between normal hemoglobin and sickle hemoglobin. The specific genetic mutation responsible for the disease was pinpointed in 1977. Sickle cell disease arises from a mutation in the hemoglobin gene. There are two main theories about how this mutation originated. The multicentric model suggests that for independent mutations occurred in different regions, including 3 in Africa and 1 in either Saudi Arabia or central India. This likely happened between 70,000 and 150,000 years ago. The unicentric model proposes a single origin for the mutation. Several key milestones have shaped the history of sickle cell disease. In 1988, Minnesota began newborn screening for sickle cell anemia, allowing for early diagnosis and management. In 1995, hydroxyurea, an anti-cancer drug, was shown to reduce painful complications of SCD. It was approved by the Food and Drug Administration in 1998 as the first drug to treat the disease. In 1997, periodic blood transfusions were found to reduce stroke risk in children with sickle cell disease by 90%. In 2008, the United Nations declared World Sickle Cell Disease Day, highlighting the global impact of this condition. Recent advances in research include gene therapy approaches targeting genes like BCL11A. These approaches aim to reactivate fetal hemoglobin production, showing promise for future treatments. Historically, treatment options for sickle cell disease were limited. However, advancements in newborn screening, drug therapy, blood transfusions, and bone marrow transplantation have significantly improved life expectancy and quality of life for those affected. The first successful bone marrow transplant that cured sickle cell disease was reported in a child treated for leukemia. This set a precedent for transplantation as a potential cure. Understanding the history of sickle cell disease reveals it as a genetic disorder with deep evolutionary roots and a complex clinical course. Ongoing research continues to inform more effective and curative therapies. If you or someone you know is affected by sickle cell disease, it is essential to consult healthcare professionals for personalized medical advice.